The federal government will launch consultations about advanced requests for accessing medical assistance in dying. Last week, Quebec began preparing to allow the practice, despite it still being illegal under the Criminal Code of Canada. People who have dementia in Quebec will be allowed to apply for medical assistance in dying before they lose the ability to properly consent. Alexander Raikin, a visiting fellow in bioethics at the Ethics and Public Policy Center, joined us earlier to unpack this.
An advance request means that you enter into an agreement with a MAID provider to essentially waive your right for final consent. We have effectively a system of advance directives already in Canada with a waiver for final consent. But what Quebec is doing is taking it to the next level. So under the current law, if you enter into a written agreement, it only has to be with one MAID provider. It doesn't, no other, the second MAID provider doesn't need to know about it. Family members don't need to know about it. The rest of the medical staff don't need to know about it. But if you enter into this written, not necessarily signed document, you can already waive your right for final consent. What the asterisk, though, is that agreement is only valid if the patient is not showing any signs of physical or verbal resistance. Quebec is getting rid of that. And I think it's really important to note what is happening right now, which is Quebec is effectively openly violating the criminal code. And more Canadians should be aware of what is happening. The Quebec police have already said that they would not be pursuing any charges, even if it's a violation of the criminal code. And again, MAID is regulated federally through the criminal code. The Quebec Medical College has been absolutely gung-ho on expanding MAID. So I think that when we're talking about advanced directives, it sounds like this is a nice, clean legal document. But the reality on the ground is that physicians will have to approach a person with dementia, a person who's possibly confused and unaware of what is happening, possibly lucid, with a different change of mind, and then forcibly restrain them to end their life. We've seen the same thing in the Netherlands, where physicians have invented a whole new protocol with advanced directives by first sedating a patient before forcibly injecting them with a lethal injection. And Quebec's new advanced directives policy came into effect on Wednesday. The federal government responded by announcing that they're going to start a national conversation on May with regards to advanced directives. So they've effectively allowed provinces to openly violate the criminal code. And not only, in a relevant section of the criminal code, but the sections that protect vulnerable Canadians from, as the Supreme Court said it, from possible abuse and error.